Good evening and welcome to our Straight Talk Asks an Expert series. I'm Beth O'Brien, Program Manager for Project Banked. We are committed to providing tools, resources, and a strong network that supports the mind, body, and spirit of breast cancer survivors in Nebraska and Western Iowa, from the moment of diagnosis through the end of life. First, I would like to thank all of our wonderful sponsors for donating to Project Banked. Because of your generous support, we're able to offer educational materials like this and all of our programs free of charge to breast cancer survivors. Tonight, we will be talking to Kaylee Slepicka on the topic of navigating conversations with your children after a cancer diagnosis. Kaylee is a certified child life specialist with over 9 years of experience walking alongside children and their families during life's most challenging moments. She's a mother of her two favorite humans, Dax and Josie, and she, her husband, and their children love spending time with friends and family, fishing, and enjoying just about anything outdoors. For the first 6 years of her career, Kaylee supported ill children in the hospital setting, offering comfort through medical stressors, advocating for their needs, and helping them find a sense of normalcy in an environment that is anything but. For the past 3 years, she has worked at Nebraska Hematology Oncology, supporting children who have an adult loved one diagnosed with cancer. She has seen firsthand how overwhelming and confusing these situations can be for children and their families, and she has also witnessed just how strong and resilient kids can be when they're given tools, space, and the support they need. Adults have their medical team to rely on for guidance, but children also need someone who can help them understand and cope with the big life-changing experiences. As a child life specialist, Kaylee fills that role. She is the person in their corner, their safe place, their listener, their explainer, and their advocate. We are so glad to have you.
Thank you.
And if you could, I think you're going to start off with your presentation, and then afterwards we'll have time for questions from our Facebook viewers.
Yeah, so I'll just kind of go through and explain what a certified child life specialist is and how I support children and their families through these times. So as Beth said, I'm a certified child life specialist and I work at Nebraska Hematology Oncology. Many people have not even heard of a child life specialist before unless you've been usually in a pediatric setting with an ill child. So what is a child life specialist? We're trained professionals who help children and teens cope through stressful life events. This is done by helping children get honest, age-appropriate information, providing a safe space for them to ask questions, providing education and preparation that they understand, using play and conversation, building rapport to help have those conversations. And then also empowering the parents and siblings and just everyone as a family to work as a whole together. We have a bachelor's or a master's degree, typically in child life, child development, or psychology or related fields. We're most commonly found in the hospital setting, supporting ill children, as I said, but we are also found in pediatric offices, adult oncology clinics, dental clinics, hospice agencies, and some other out-of-the-box spaces to supporting children. So what am I doing to support the kids? So it usually starts off with a parent that's been diagnosed and they wonder, should I tell them I have cancer? Are the kids going to be okay? Do I need to tell them? They really shouldn't have to worry about it. These are adult things, not kids things. They're too little to understand. They can't handle a visit to the hospital. It's way too scary. It's better if I just tell them my cancer is going to go away and everything will be fine, even if we know that that's not true. So I like this quote: in a world where children are excluded from adult answers to basic questions, those they work out for themselves will almost inevitably be more distressing and unhelpful. So that's just saying if we don't provide answers to these questions that kids are having because they always know something's happening. They might not know what's happening or why everyone's acting differently, but they know something is up. And if we as adults don't give them those answers, then they're left to figure them out by themselves. And what they usually come up with in their head is a lot scarier than what we actually tell them. And then they're dealing with and coping with that alone instead of having us by their side for it. So one thing I like to use is a worry monster, and this is a place that kids can write down their worries, and it's a way to get those worries out, and a way for parents to read and understand what's going on with kids, because kids don't just sit at a table and talk. They want, they play, they do things like this to get their words out. And so what I have up here is just an example of a time I did this activity with kids, and this is what they wrote in there. I'm worried he's going to die. What if he never gets a liver? I hope you will get well soon, Papa. So it shows that kids are thinking these things, and they're alone with these thoughts if we don't give them a way to express it. So the conversation, parents are usually like, how do I have this conversation? I think it's really helpful if you can prepare yourself. So make sure, am I mentally ready to have this conversation? What's the name of my illness? What led to this diagnosis? What do I know right now? And what do I anticipate to happen next? So it can be helpful if you kind of answer those questions before you go dive in and have this conversation. And then how does each child cope? So if you have a teenager and you have a 5-year-old, do you need to have separate conversations? Does one want to know everything and one just wants to know a little bit? Are they going to react differently? Do they need to be able to have mom all to themselves? Or is it going to be good to have the two kids together and then they can support one another and they feel comfort that way? So just, sitting down and thinking about what each kid needs, what their developmental understanding is. And that's another way your child life specialist can help you is, how do I explain what cancer is to a 5-year-old? How do I explain it to my 15-year-old? Because that looks different. And then make sure it's a good time. Make sure they didn't have a terrible day at school. They're not hungry. They don't have to rush off to practice afterwards. We want to be able for them to receive this information and then cope with it. And, does coping look like going to their bedroom? Is it eating comfort food? Is it snuggling with mom and dad after? Is it crying? Having all of those feelings. We want to give them the space to do that, because if they have to rush off to practice, then that would really stink for them, and they're left to deal with these emotions in a public place without their safe people. So this is just kind of an example of the conversation. I went to the doctor because I haven't been feeling well. My back's been hurting. I found out that I have cancer. It's called lymphoma. So we're telling them what happened to lead to, what made you go in, that you weren't feeling well, that made you go to the doctor. And then you're telling them, well, I found out I have cancer, so you're naming that disease. And then we're going to go into, so what do I know now? I know that I will have to take a special medicine called chemotherapy, and that's going to hopefully help my cancer go away. I'm not sure when I'm going to start taking that medicine yet. My doctor's still going to run some tests to learn more about my specific cancer. And then I do know that in a couple of days, one of those tests is a PET scan. This is a special picture that takes of the inside of my body that will show us if there's cancer anywhere else. I know I have to have something called a port place. This is a small device that will go under my skin and help me get my medicine. So that's just kind of an example of how those things can go in the language that you would use. And you don't have to jump in and give all this information at once. It can be helpful to just kind of, maybe day one, you're just saying, I have cancer, and that's all they're able to digest that day, and that's okay. You just really have to follow your child's cues and kind of like lean into your mom gut and your dad gut. I tell parents that a lot. I give lots of advice, and I know what's worked from experience and education, but at the end of the day, it's your kids, and you're going to be in that moment with them. So just reading the body language and eye contact and all of that stuff, and you'll kind of know oh, maybe that's enough for tonight, and tomorrow or a couple days later, we can go into more detail. This, I won't go all the way through all this, but this is just like a developmental guide to help you understand what kids at different age years are, what they're understanding, how different concerns and worries that they might have. So someone 0 to 3 isn't really going to understand cancer, but they are going to notice a difference in routine, and they're going to notice mom being gone more. That is going to affect them. But a 12-year-old is going to understand a little more and probably want some more detailed information about what is your cancer, tell me more about chemotherapy. Maybe they want to come watch you get a treatment to ease some of that anxiety. So this just helps understand those different ages. More ways that we help. So the developmentally appropriate language, which we talked about, preparation with the parents for that conversation. So if you're just really anxious as a mom or a dad, grandma, grandpa, aunt, uncle, about having that conversation, your child life specialist can sit down with you and say, hey, let's go over this together. What are you nervous about? What words can I help you find? And some people are just like, I can't do it. I can't have this conversation, and that's okay. Your child life specialist can sit down with you and your kids and help you have that conversation as well. We're here to empower you as much as we can, but also if you feel like, that's just too much for me, I'm gonna break down and I know it, that's okay, then we're here to support you in that way too. And then just like normalizing everything for the kids, validating their feelings, doing medical play. So that's really important. The medical play kind of helps medical things be less scary. So this is one of my dolls that we use. He has a port, so he has it accessed with the needle, and then there's a real port underneath. So we can show the kids when we say mom or dad's getting a port. Here's what a port is. Maybe a port sounded really scary, and now you see it's this thing with a soft little cushion, and it's not so scary anymore. And you can understand what that bump under mom's skin is that you're feeling all the time. And, you know, with safety and help, depending on age, let's go through and let's practice. When mom says she's getting her port accessed, what does that mean? It means we clean it, and then the nurse lets it dry. And cleaning it's very important because when I'm getting chemotherapy, my white blood cell counts go down, and that's what fights all the bad germs. So we clean everything. We clean our hands. Everything's very sterile. That's why the nurses do that. And then we practice putting that port in, and okay, now we can get our medicine. We can hook it up to a syringe, and just really letting them play through those things, and then they can ask questions, and you can learn misconceptions that they might have. Like they might think that this port was a big metal thing with spikes in it. Like you just don't know what kids think. So telling them what's there and showing them what's there clears up those misconceptions for them and just gives the opportunity for good conversation. So we've used that before. I like to let kids make their own medical doll. So maybe mom or dad, grandma, grandpa, whoever we're supporting doesn't have a port. Maybe they just have a PICC line. So then we could do a PICC line. Or maybe they need a G-tube because they're having troubles eating. So then let's put in the G-tube, and then we can talk about that and why we need that and how it's helping make mom or dad feel better. For kids, especially younger kids, mom or dad losing hair is a big thing. It's a big change, and kids don't like change, and they need to be prepared for change. And all of this preparation is the biggest thing. If we can prepare kids for what's going to happen, then we can give them the tools to cope with that, and they usually do amazing. So this Barbie doll, her hair comes off, and she has a wig and a scarf and headbands and stuff. So this can be a really helpful way to kind of play through those things, play through those emotions. Mom's going to lose her hair, but also we see that afterwards it can come back. So mom's hair is going to come back. Maybe you can help me pick out some wigs and scarves, and that's a way that you can make this unfortunate thing that's going to happen a little more fun for the kids, and help them understand it. I have a chemo duck, so that's for younger kids. He has like a more playful little port here, not the needles, and as a in your face, aggressive, I guess, as this one is. So this is good for littler kids. The other day I had a kid who was really concerned about his dad's chemo pump. So some patients have to wear their chemo home for like a day and a half, and then they come back to get it removed. So I had a kid that was like very concerned about this. So once again, just being able to like press the buttons, be hands-on with it, and see, like explain, like this is where the chemo is. This is just the type of chemo that dad needs, and his has to run over a longer period of time than just in the office. Just giving them the opportunity to touch it, feel it, play with it makes it a lot less scary. And up there I show like a weekly planner. I tell parents that's really helpful. Kids are super egocentric, and despite this huge thing that's happening to the parents, the kids want to know that they're still going to be taken care of. The world revolves around kids. So this planner can help kids see like, oh, okay, grandma and grandpa are taking me to soccer practice on Monday. Mom gets chemo on Tuesday, so dad's picking me up and taking us to whatever it is. Wednesday, mom usually doesn't feel good. We know on day 3 she usually doesn't feel good, so then they're kind of prepared for that. It just lets them know like, okay, I'm covered, we're good. They still have this all figured out even though they're dealing with this other huge thing. When the cancer doesn't go away, and these are the hardest conversations I have. I don't feel like they ever get easier. It's the hardest words to come out. But if parents can start having these conversations with children and not giving them false information or false hope, really beautiful things can happen when that time comes. So child life specialists are able to help parents down that road and just help find the words, help know when the time is right, give the hug, give just that listening ear sometimes that parents need, and just validating like, this is horrible and I'm scared, and how do I do this? How are they going to be okay? We're here to support through those hard times too. So I created something just called Tell Me Your Story. It's just a place where parents, grandparents, whoever can write down like, this is my favorite food, this was my high school car, these are the sports I played, this was my favorite vacation, just writing down those memories, doing legacy things like handprints, creating a thumb bee necklace. It's really just meeting the family where they're at, seeing what they want to do, what they're comfortable with. And I always go back to that, you know, what's your family good with? These are the things I can help you with. These are the things I suggest you do, but what does your family feel is right for you? So there's a bunch of stuff. I've helped a mom like with letter prompts before, like writing letters for all those big milestones. When you're in the thick of it, you probably have the best intentions and you want to do all these things, but sometimes you just need someone to put it in your hands. Here's the paper, here's the envelope, here's the writing prompts. So kind of taking the thinking out of it for you and just saying, here are these things. If you want to use them, great. If it really makes you mad that you're in this situation and you have to do it and you want to throw it away and that makes you feel better, then that's fine too. But just so you have it and you have the opportunity to do it if you would like. And just words I'd like to leave you with, which these are long. I kind of already said this, but child life specialists, we have the education, we have the experience, but parents always, you just need to follow your mom gut, follow your dad gut, listen to your kids, ask them questions. Kids are just so much more resilient and they know so much more and they know themselves so much more than we give them credit for. And just as adults, like, we're sad and we cry and we don't get it and we're mad and we are angry and we need the space to feel those things. So we cannot expect more of kids than that. They need the space to feel the things. They need to be able to be mad. They need to be able to not understand it. I know a lot of times parents are like, I don't want to see them cry, but it's okay if they cry, and it's good if you cry with them. It gives them the permission to do it. Like, this situation really sucks for everyone involved. So going through those emotions together is okay, and it's really good for everyone. I quoted a book by Kathleen McHugh. She's a certified child life specialist, and she wrote How to Help Children Cope with a Parent's Serious Illness. And she said something in there along the lines of, mistakes made with love are mistakes easily forgiven. And so I like to tell parents that, because we're telling you good ways to do it, but then I'll also tell you that it's not black and white and there's not a right and a wrong. There's just better ways to do it. And if you don't get it right on try one, or if you're coming back a month later and you're like, oh, I wish I would have told him sooner, or I should have told him in this way instead of that way, it's okay. The decisions you're making because you love your kids and you want the best thing for them. So if those decisions are going to be easily forgiven and easily repaired, because you're doing it all out of love. So I just really like that quote, because I think parents feel a lot of pressure. Mostly all the parents I talk to, they're not even worried about their diagnosis. They just want to know that their kids are going to be okay. And if you love them and you're in it with them, they're going to be okay. And you don't know the answer to everything. That's another thing I like to tell parents. It's okay if you have to say, you know what, that's a great question, and I don't know the answer to that right now. Let me get back to you, and I promise I'm going to get back to you, but I just want to really answer that correctly. That's okay. And just that you can do this. I don't know. I've been fortunate not to have to walk in these shoes, but walk along people who have. And I can assume that it feels impossible. But I do know with the right tools, the right support, and all the love that you can do this. So child life specialists help family as a whole. We know what happens to you also happens to your child. So please reach out with anything. We're kind of here to hear it all and support through it all. And if we don't know the answer, we can find somebody who does.
You said now how to prepare your child for this, but then what signs should I look for that show a child is struggling more than they have let on?
Once again, I go back to that mom guilt, or mom gut.
Sure.
You just know if something's off. Like maybe usually after supper, they always sit and talk to everybody and have conversation. But every night he's going to his room and he's just not talking much. That might give you a clue like, something might be up here. And so just trying to talk to kids like, hey, what's wrong? Sounds simple, probably a lot easier said than done. So I like to suggest to parents sometimes like, do you need to go for a drive and talk in the car? Do we need to sit on the couch in the living room with the lights off? Because even as adults, like having serious, hard conversations is hard.
Sure.
And then we want a kid to do it. Mm-hmm. So do we need to play a game and kind of be like, how are things going? Do you have any questions about mom's cancer? I went and got chemotherapy today. Do you have any questions or worries about that? A lot of times parents just think kids don't hear things. They're not listening to our conversations. They're watching TV. Just this year, I've had 2 kids tell me that they knew their parent had cancer before their parent told them. One girl had looked at her mom's phone, and another kid had overheard conversations. And so it's just, they know something's happening, and they're gonna try to figure it out, just as all of us would too, So just listening to your kids, asking them the questions, giving them the opportunity to talk, I think is the most helpful way to know kind of what's going on.
Is there a certain timeline that you think that you should tell the kids, or like immediately, or?
It's hard because I like to say as soon as you're comfortable with it. I definitely think the patient and the spouse or caregiver, whoever else is involved, and if it's just you as the patient, you have to be ready to have that conversation. If you've been away at the hospital for a long time, so let's say you get your diagnosis in the hospital. So you have that diagnosis, but then you still have to go to the office, you have to meet your oncologist, you have to go through all this testing. You don't really have a bunch of answers yet. A lot of people like to wait until they have that. But if your kid's really hounding you and is just like, I know something's up, then I think that's the right time to have that conversation. You just have to be comfortable and ready to have it, I think is the most important part.
Okay. What are some coping tools or activities that you have found most helpful within a family?
The worry monster for sure, I think is super helpful. I've had a ton of kids love this. Like I have a girl who takes this to school with her every day and just keeps it in her book bag. I have one family, people use it all different ways. So one family, you put the worries in and that's your safe place. Mom and dad aren't reading it. It's just a safe place to get it out. And then I do have a family who she puts her worries in there and then her and mom sit down and talk about them. With some teens, I have like an anxiety journal, a stress journal, so just a place for them to write those things. I do a Hope Huddle support group, and that's a chance for kids who have parents with cancer to get together and just kind of normalize that and be able to be around other people going through the same things they are. And I feel like art's a great way for kids to get everything out too. And then just play. Play is the language of kids. So we learn about what kids are thinking through play. We're able to help them cope through play. It's just a wonderful tool.
Nice. How do you think we can have the kids included in care or support roles of the parent or loved one?
Yeah, I think letting the kid be as involved as they want to be is great. So do they have to do a couple more chores at home? Do they want a report every time? Like, they're really detail oriented and they have a little anxiety. So every time you go to the doctor, I had one girl who I was like, does it help if mom and the doctor write down 3 things after every appointment so you feel like you're getting the information that you need? And then that was helpful. And some kids are like, I don't want to know. I don't want to talk about it, like out of sight, out of mind, unless it's really serious and it's something I have to know. I just don't want to know about it. So that's where it's important to talk to the kids. Ask them, what do you want? What do you want to know? How often do you want to know? How do you want me to tell you? As adults, sometimes I think we forget to ask kids what they want and what they need, and they are our greatest resource in helping us figure that out.
On that same note, as far as the kids, what about when their peers are asking questions about their mom? Are there certain things that they can say or certain things that the parents can say?
Yeah, I think giving them the tools, the language. My mom has cancer. Or do they not want to talk about it? Yeah, my mom's really sick right now and I don't feel like talking about it. So I think helping them find those tools and then also doing that preparation again. So in today's world, I feel like most kids have encountered cancer. They've at least heard about it. And usually most people, it seems like, think cancer equals death. And so preparing kids that, hey, you might have your friends come up to you and say, I heard your mom has cancer, and they might have this really sad face and be like, I'm really, really sorry. And they might say something about, is your mom going to die? So just helping them be prepared for those conversations and letting them know, like, hey, yeah, you're right. A lot of people do think cancer means death. Luckily for me, my doctor thinks that we're going to be able to make my cancer go away, and we're really excited about that. If that's not the case, really tricky situation, preparing them for it. If your cancer isn't curable, you don't have to tell your kid right away, like, I'm going to die from this. That's something you have to get really specific with ages and personalities and things and have a bigger, deeper, meaningful conversation about that. But just saying, I lost my train of thought there with it, but just preparing them for that and just letting them know that you can say, yeah, my mom is sick with cancer and I don't want to talk about it.
Sure.
So just giving them those words and the permission to say, hey, I don't want to talk about it, or yeah, this is what I know about my mom's cancer.
Awesome. And on that same note, as far as like communicating with teachers and coaches and school counselors, is it the same as with the peers, or would you approach that differently?
Yeah, I think, Sue, I always suggest getting the school counselors involved. And that's where a child life specialist can even come in, and let's say you're a mom and you're a teacher. Okay, do you have the child life specialist come in and talk to the whole third grade class about it? This is what Mrs. Smith is going through, and she has cancer. She might be gone some days because she doesn't feel very good. She's going to lose her hair. So we bring these tools in and we talk about it. We allow them to ask all their crazy questions and get it out of their system. And then it's like, okay, we've talked about it. Now we can go on.
Nice. When is it time, do you think, to involve additional mental health professionals for kids?
Yeah, so child life specialists are definitely not counselors, and we really like to make sure that line, we don't cross into that out of our scope. And so I think it's just through sessions and talking and, you relaying the concerns you're having about your kids, and then we can say, hey, I think this goes past what we do, and I have a list of like local counselors that I will offer families to go check out then and get that additional support.
Nice. When I was diagnosed, I did research some books and stuff for my kids. Are there any books that you would suggest? I know when I did it, I think it was, I don't know if it was American Cancer Society or something, they had a book that, like a drawing book, because my kids were younger.
Yeah.
Is there certain books that you would recommend?
Yes. I love the How to Help Children Cope with a Parent's Serious Illness for parents. Okay. And then I actually have just some worksheets that I like to give out to parents that I've created that I think are helpful. And then there's just a plethora of kids books, teenage books. So I think I do have recommendations, titles right now.
Sure.
Like one's called The Cancer Party, I think. And so, yes, there's a ton of books and stuff that you can use to go through that. And then I also think like simple worksheets and stuff can be helpful too, just depending on kids' ages and attention span and those kind of things.
Sure. And are there any local support programs specifically for children dealing with a parent's diagnosis that you know of?
So there's grief programs, like there's Morning Hope in Lincoln, so we refer to them if someone has passed from cancer. Otherwise, just local child life specialist is, as far as I know, like locally to help support people through that. And I do know there's like some really great online resources that give you a good virtual community.
And you were saying something about you guys do something where the teenagers and kids come with their parent?
Yep, so I do Hope Huddle, which is a support group for anyone who has an adult loved one with cancer. And that's open to anyone in the Lincoln area. You don't have to be an NHO patient, but it's just a place for kids to come together. We usually do a craft or, play a game, do something, hands-on activity. And it just allows kids to be in a space with other kids that are like them. Because for kids, it feels like such an isolating thing to have a parent with cancer, and to see other kids going through it with them, I think is just the best support that you can get.
Yeah, most definitely. My son, have you ever heard of Camp Kesem?
Yes.
Yes, yeah, that's for kids with the parents going through cancer. They do a camp in the summer, and that's something that he really enjoyed when he first, not so much anymore because he's a teenager, but when I was first diagnosed.
Yeah,
so,
that's awesome. I'm happy you thought of that because I didn't, and yet that's through UNL, right?
Yeah, the students at UNL do that.
Yes,
so,
they're amazing.
That's a great thing. Okay, well, I don't think, do most health systems offer a child life specialist?
So I'm the only child life specialist in like a health system in Lincoln.
Okay.
And then in Omaha, they have them at Nebraska Medicine.
Okay.
So they will support kids of adult patients. But then the other two hospitals in Omaha that have them, it's for pediatric patients.
Okay.
So it's not super common. I think the world of NHO for having a child life specialist, because it is that extra level of care for the whole family and the patient. And so I wish everywhere had them, because it's just, like I said in the beginning, parents are worried about their kids. They want to know their kids are going to be okay. So I hope it continues to grow and you continue to see more of us.
Yeah. Can anyone see you, or do they have to just go to your NHO?
Yeah, so right now I'm just through NHO. I help NHO patients.
Okay.
So yeah, you can reach out though. I love to give resources and stuff.
Okay. Do you recommend the same steps for older children that you do for younger children?
I do. I think just like that little tidbit I did in the beginning of preparing for that conversation, for older children, you're probably going to want more details because they're going to want to know some more stuff. And the older children start to understand more the significance of what's happening. And it is important to be prepared for them to ask, are you going to die? That's always the hardest sentence I say to parents, but kids are most definitely thinking it if they're not asking you. And when you get to those older kids, that's really something you want to be prepared for. And it can be, we know we're not going to be able to make this cancer go away, but I plan to do chemotherapy so that way we can keep it away for as long as possible. And it just, like I said, depends on your kids' age, how far you take that conversation, when you have that conversation, and you just never want to lie to them. So right away in the beginning, and I don't care what your prognosis is, you never want to say like, 100%, we're going to cure this, my cancer is going to be gone forever. I'm never going to die. We never know when something like that's going to happen. It could be a car accident. It could be a different illness. So you just never want to make that promise to kids, as hard as it is. Leaving the tiniest crack in the door is so helpful. We're going to try to make this cancer go away. My doctor doesn't think this cancer is ever going to come back. You're saying we don't think you have to worry about it, but you're leaving the door just a little cracked and you're not making any promises. So I think that's really important.
Sure. How do you describe what cancer is?
So it depends what age level, but a basic one that I think even adults like sometimes adults are like, I'll take your hand out, just because all the language and all the information you get is so overwhelming. But I usually just tell kids our body is made of good cells, a ton of good cells, and mom, dad, whoever got some bad cells in there. Those bad cells don't behave, they don't listen, and they grow really fast. So what that is called cancer. And then, if it's a tumor that you have, you can say that's like a lump of those bad cells together, and mom and dad are going to have surgery to try to take those bad cells out. But we also have to do chemotherapy because there's so many of those tiny little bad cells. So chemotherapy gets rid of cancer, but the bad thing about chemotherapy is it doesn't always know the difference between the good cells and the bad cells. It just kind of wipes them all out. So that's why mom might lose her hair. That's why we have to be careful about germs. That's why, sometimes we have these side effects, because that chemotherapy is really good at getting rid of cancer, but it also gets rid of some of those good cells too.
Okay. Thank you so much, Kaylee, for answering all our questions and for all the information that you gave us tonight. This recording will be posted later on our YouTube channel, and please remember to check our website, projectpink.org, for upcoming events. Thank you.